what's going on, you guys? This is Madam, and I'm coming back to you again. This time we're gonna go over to 5 ABC Cleveland News, and it says Cleveland Clinic cancels Eastlake's man his kidney transplant because he's not vaccinated. It says a local couple is left with pain and confusion after they say a kidney transplant surgery has been canceled by the Cleveland Clinic. You might remember the clinic announced a new policy that both the donor and the patients need to have a COVID vaccination before transplants can take place at the clinic. The announcement caused some confusion and concern for 52-year-old Mike G. and his wife Debbie regarding his upcoming kidney transplant surgery. The couple said surgery plans were going well at Cleveland Clinic until last Friday when the couple told News 5 the clinic put his surgery on hold because the donor, Sue George, who is a family member, was not vaccinated. Then today, both of the Grins and George said they got a call stating the surgery has now been canceled altogether. George said she is very disappointed. We have someone who needs a kidney. We have someone who's got a 1 in 100,000 chance in a match. How are we going to do this? George said. According to George, the clinic told her it was going to stand firm on its vaccination stance. However, the Grins and George were under the impression that the vaccination mandate wasn't supposed to go into effect until November 1st. So they questioned why Wednesday's surgery was canceled. Cleveland Clinic said it's striving to minimize risks, and vaccination is an important component to ensure safety. If transplants are using live donors, the clinic said the mandate is active now. The November 1st deadline is for deceased donors. Cleveland Clinic issued the following statement regarding transplants and vaccinations. The health and safety of our patients is our top priority. Cleveland Clinic has recently developed safety protocols for solid organ transplantation, that requires COVID vaccinations to be an active transplant candidate or living donor. Vaccinations are particularly important in these patients for their safety. Living donors for organ transplants have been a life-saving treatment, but it is not without the risk to the donor. For the living donor, reducing the risk of COVID-19 infection around the time of their surgery and recovery is crucial. We continuously strive to minimize the risk to our living donors, and vaccination is an important component to ensure the safest approach and optimal outcome for donors. For the transplant candidates, in addition to a major operation, medications taken after an organ transplant, weakens a person's immune system. Serious complications of COVID-19 are most likely to develop in individuals who have weakened immune systems, as their body has a reduced ability to fight and recover from infections. The FDA authorized vaccines have been determined to be safe and effective and are the best way to prevent severe illness and death from COVID-19. For organ transplantation, using a living donor, which involves the living donor undergoing scheduled surgery, we are requiring COVID-19 vaccinations for both donor and recipient before we can proceed with the surgery. For the safety of both. For organ transplantation for a deceased donor, patients currently on the waiting list have until November 1st to meet the Cleveland Clinic's COVID-19 safety protocol. If patients waiting on an organ from a deceased donor are not vaccinated after 11/1, they will be made inactive and wow, that's crazy. The vaccination is to prevent severe illness or death from COVID-19. To date, we have not removed anyone from the transplant waiting list because they were not vaccinated. Meanwhile, Debbie Grimm told News 5 on the phone that she is devastated by the news, and George, she just wants Mike to get healthy soon. We have one goal here, and that's to get Mike a kidney. So it may come down to looking for another donor, George said. In our original story, George said she would donate a kidney but was firm in saying she would not be getting vaccinated. Since then, a number of people have come forward to ask if they can be tested to donate a kidney. If you are interested in learning more about organ donations, you can click on this link. Okay? And that's pretty much it for this story. If you live in Cleveland, this is one of the things, and you're waiting for an organ, this is one of the things that you will have to face. Also, the article is done by Jonathan Walsh. And I mean, man, like, if it's coming to, like, if it should, like, I will say, if a person is waiting for to get a kidney or an organ, wouldn't it be easier to just test that person to see if they're COVID negative? Why does it have to be a mandate that the person is vaccinated? They run tests prior to a person receiving an organ, and I'm pretty sure they do the same on the side of the person that's donating the organ. Wouldn't it be much simpler to just test the person that is the donor and the recipient, and that can also minimize the the risk with it? I don't understand why it has to be mandate. I'm very much confused on that. If that's the case, that would, I mean, to me, it's basically saying that them just simply testing a person and they're coming back with a COVID negative reading or a COVID negative test is not sufficient enough, as opposed to a donor that is vaccinated. I don't get that. I'm very confused about that, and hopefully we can get a conversation going, especially if you live in Cleveland. Like, I mean, I hope this doesn't become a state to state thing in hospitals. I mean, you're essentially putting the person between a rock and a hard place when their right is to choose their own. I mean, you're essentially just taking away a person's right to say, hey, I mean, regardless of what side of the fence you swing on, I'm not advocating for unvaccinated people, and I'm not advocating for people that are vaccinated. What I'm saying is that, you're really putting more of a burden on a person, especially if the person who is a donor or a recipient of a organ, to follow this quote unquote mandate when all of that can be solved and with a test. You know, you testing the person that comes out negative. You test the person right before surgery, and they come. I mean, they have rapid testing. Like, it's no way that it should be a mandate. Yes, I do understand when you get organ transplants that your immune system is not up to par. However, if the donor is healthy and the donor is COVID negative, then I don't understand what the issue is. I mean, they have tests in place to test for these things. But I'm just going on. I'm rambling, and I would definitely like to get the conversation going in the comment section. I just don't get it. I just hope that it doesn't become a thing in my state. Because if they can do that with organ donating, just imagine what other elective surgeries or major surgeries, they would do, where the surgery will make a person's immune system. What about cancer research? Like, I mean, it opens up the door for a lot of, what ifs about it. People that go through chemotherapy, I can use that as an example. Will they be required soon to be fully vaccinated, or they can't get chemotherapy? Like, you're essentially, in some cases, it's going to come down to you're handing a person a death sentence on top of a death sentence. You understand? Because you're essentially taking away a person's right to choose. It's a person's choice. It's no different from any other issue in regards to medicine that people have faced for years. I mean, another example. I mean, it's so many examples, but I have no idea. I don't know where they're going with this. Hopefully we'll get some clarification. Hopefully there'll be more study and research into this mandate. And don't forget to like, subscribe, and share. And don't forget to comment down in the comment section. And I will get back with you guys at a later time.